Welcome back to my channel and welcome to this quick healthcare insight video about why people should discuss colon cancer screening with their healthcare providers. First, a little background about colon cancer. Colon cancer is one of the commonest cancers in the world, and screening can save your life. Colon cancer is the third most common cancer and the second most common cause of cancer deaths. Most people who get colon cancer are over 50, but in the last decade, the rate of colon cancer has increased in younger adults. It can strike anyone, even otherwise healthy people with no family history of the disease. Unlike many cancers, colon cancer is preventable. It usually starts from little growths called polyps that develop on the lining of the colon. Over time, some of these polyps can become cancerous. There are multiple different screening tests that are available for colon cancer. These mainly fall into four different categories. Number one, stool tests. These are tests that examine stool samples for the presence of blood or components of blood, even if it's only microscopic, meaning that you can't see it. Also, these tests in some cases look for genetic materials in the stool that are often found in colon cancer cells. Number two, sigmoidoscopy. This refers to a procedure where a tube with a camera is inserted up to the last portions of the colon to examine these sections of the colon. Sigmoidoscopy does not examine the entire colon. Number three, colonoscopy. This is similar to sigmoidoscopy in concept, except that the colonoscopy tube is highly flexible and is long enough to go through the entire colon, that's many feet, and even reach the end of the small intestine just past the beginning of the colon. The colonoscopy tube has special equipment to view, photograph, and record on video the entire inside of the colon, as well as to inject materials into the colon if needed, and also to remove polyps or other growths that are found inside the colon. A colonoscopy can only remove growths up to a certain size limit. Number four is CT colonography. This is computed tomography colonography, which is essentially a CT scan that uses regular X-rays in a CT scanner to look at the inside of the entire colon. Let's talk now about which of these different procedures that were just discussed in the previous section are recommended for colon cancer screening. What do different nationally recognized organizations, such as the American College of Gastroenterology or the American College of Physicians, recommend? There are many other nationally recognized organizations that also make their own recommendations for colon cancer screening. Different organizations do have different recommendations about the exact age at which to start screening for colon cancer, and also these different nationally recognized organizations differ in terms of which combinations of the previously discussed tests they consider acceptable for or prefer for colon cancer screening. Some organizations recommend colonoscopy as the preferred test, and colonoscopy is often considered the open quote gold standard closed quote for colon cancer screening. This is because it's the only procedure that can treat, that is, remove polyps or other colon growths found anywhere in the entire colon by removing them at the same time the screening colonoscopy is being done. Despite colonoscopy often being considered the gold standard of colon cancer screening, depending on your age, family history, and other risk factors, you can decide with your healthcare provider which either single or combination of the available screening tests make the best colon cancer screening testing for you. There are different time intervals at which each of the 4 categories of tests need to be done to be effective at screening for colon cancer. So, for example, a colonoscopy, if that's the chosen test, will be done much less frequently than a stool test to detect blood. Just remember that any abnormal results done on any screening test other than a full colonoscopy will require timely follow-up with a colonoscopy to complete the screening process and to remove any precancerous polyps or other potentially dangerous growths in the colon if they are found during the colonoscopy. Finally, let's conclude with some closing thoughts and an overall summary. Regardless of which test is done to screen for colon cancer, the important thing is that you get one or more of these tests done at the particular test's recommended intervals. Colon cancer screening can prevent cancer or find it early when it's easier to treat. Polyps and early-stage curable colon cancer don't usually cause symptoms, so the whole point of cancer screening is to get rid of polyps before they turn into cancer. Don't wait for symptoms to appear to get tested or screened for colon cancer. Screening can help you avoid surgery, chemotherapy, radiation, and other complications that come with advanced cancer. Colon cancer screening can even save your life. As always, check with your own healthcare provider to determine which of these colon cancer screening tests, if any, are appropriate for your specific circumstances. Thanks very much for watching and listening, and until the next video, stay healthy.